Childcare. To work, parents need a safe and reliable place for their children. However, accessibility and affordability are huge roadblocks, with the average price of daycare reaching $9,500 in 2020. On the flip side, childcare businesses in our state operate on narrow profit margins and often struggle to pay adequate wages, resulting in high staff turnovers. What needs to change? We'll discuss these issues and much more right now during Chasing Childcare, a KX Town Hall. Here are your hosts, Brooke Williams and Alicia Huck.
Hello, and thank you for joining us for our latest KX Town Hall.
Families across the nation are facing obstacles to finding and paying for quality childcare, and this is happening in our cities and in our rural communities.
And that's what we'll focus on in today's Town Hall, Chasing Childcare. The cost of childcare, it's been steadily growing, and parents' earnings have not kept the pace. And here in North Dakota, it's impacting families every single day. But first, let's meet our panelists.
Joining us is Kay Larson, the Early Childhood Division Director at the Department of Human Services. We also have with us Sheila Morris, the owner of We Folk Child Care Center.
And we have Tessa Moberg, and she is the Program Director at Wolf Pup Daycare. Thank you, ladies, all for joining us today.
Yes.
Well, first of all, we're talking about what is the state of childcare in North Dakota. Now, we can go into the overall state of it and how you two, Tessa and Sheila, are dealing with the situation here, and how many kids are in each of your daycares. Lots of topics to cover here.
And Kay, we'll start with you. Can you just give us a brief overview of where we're at here in North Dakota?
I sure can. So, excuse me. We have about 1,200 licensed child care programs across the state of North Dakota, and I would say the majority of them have waiting lists, and it's a challenge for parents to find child care when and where they need it.
And Sheila, can you talk to us a little bit about that? I know your daycare recently opened, so do you have that waiting list? Are you at capacity yet, or are you still taking?
We're not at capacity, but what the struggle within the state and even just within North Dakota and Bismarck is that there's not enough infant spots that are open. So we do have a waiting list. We have 85 infants on our waiting list, not including our whole overall waiting list, which is 177 kids.
And that is in a city in the state of North Dakota. That is in Bismarck. And we also have the smaller rural communities such as Watford City, where Wolf Pup Daycare is. Tessa, what are the waiting lists looking like there?
So we have at least 2 pages of a waiting list. We don't categorize the ages on our waiting list. Right now we're telling people we won't get them until at least May of 2023, but the county just decided to fund a new daycare center with portables, and so we're hopefully getting some more temporary daycare in the spring. So it's full. We're full.
Mm-hmm. And to follow up on that, and this is really a question for any of you, when should a parent start looking for childcare with all of these waiting lists?
Before
before
they're
pregnant.
Yes.
So you'd have to see it into the future, essentially, at this point.
If you're planning on having a child, I would recommend either talking to someone who has a child already and asking them how that they came about finding childcare, getting the recommendations, but then also making calls and getting yourself on a waiting list.
And you ladies were talking earlier about the fact that you have parents right now who are planning in advance of becoming pregnant.
Yes.
And so what, you said sometimes there's families who they're reluctant to get on that waiting list right away, but what are the pros of doing it, even if you don't know for sure that that is where your child is going to go?
At least you have some place where they might be able to fit you in.
Mm-hmm. And I think if you don't get on it, you're going to want to get back on it, and then your time is just longer on it.
Mm-hmm. Yep.
So in this case, it's certainly great to plan ahead.
Yes, be a planner.
And Kay, there's a labor shortage in virtually every industry right now, and it's compounded by the shortage of affordable, accessible, and quality childcare for parents who want to work. Can you speak to us a little bit about what are the most significant challenges in the state when it comes to addressing a childcare shortage?
Right. Well, I would say North Dakota is certainly not alone in that challenge. I think for child care programs, they're competing with the other sectors of the workforce for employees. And oftentimes, the wages and the benefits that might be available in the child care sector don't compare to other workforce.
And Sheila, you've started off addressing this with your child care center that
Yes.
you own here at WeFolk. How did you go about doing that?
Well, we offer our employees a more competitive living wage, as well as health care benefits, time off, vacation time. I can't expect someone to do something that for me that I'm not willing to do for myself. And so taking into consideration everything that people need in their daily lives, as well as a child care benefit when they work for us.
And it might be a different situation when you have a nonprofit child care center. You might not have that ability to offer those kind of benefits.
We do actually, we've had to. Like when we were in the middle of the boom, no one wanted to work childcare because you could go anywhere. You could go to the Hardee's and make more. And so we did have to address that between like 2019 2020. And so now we offer full benefits after 60 days. We offer a higher wage. We also do a daycare discount. We offer Thrivent. So you have to get those people in there to work. And it's a busy job. You know, people think that they're going to come in and sit in a chair and rock a baby all day, and that is not happening. You're rocking one and putting one down and picking up another one, and so it's very busy.
And this is, again, a question for any of you. When you have a staffing shortage, especially when it comes to the care of a child, how does that impact the quality of care and the child's safety?
Well, maintaining ratios within your rooms, your staff to child ratios are important, and so making sure that you don't have too many infants in one room where you don't have a staff member to be in there. Because the last thing you want to do is tell a parent, sorry, my staff called in today, so I can't take your child. So one of the things that we're working on is being a little overstaffed, where we can send somebody home or be able to call them and say, hey, like, we don't need you today. We're great, but you also have to understand that we do have parents that are our employees, and their kids are going to get sick and the employees are going to get sick. So trying to meet that head on or in front of it has been something that we have been working on.
Okay. And one more question here, maybe Kay or either of you. What can parents do if they're not able to find child care?
If they're not able to find childcare. So the state partners with Child Care Aware of North Dakota, and we have at Child Care Aware the database basically of all of the licensed child care programs, and so they can work with a referral specialist and see if there is licensed childcare available in their community. They get referrals, not recommendations, and then there's also information on the childcare website about interviewing providers and having that conversation to see if they're finding the right fit for their family.
So a lot of good resources.
A lot of good
there.
resources. And then I would say families are using family, friend, and neighbor. So maybe working alternate shifts with a spouse or a neighbor to be able to accommodate childcare.
Networking.
Networking.
Yeah. Always important. Well, thank you for that, and stay with us because there's much more to come in our KX Town Hall.
Rehab, pet artwork, kids games, and great food. Participate in live and silent auctions as you meet adorable, adoptable animals that could be the perfect addition to your family. Admission is free with a free will donation, with ticket purchases for on-site activities. Wolfstock, bringing peace to pets.
Welcome back to our town hall, Chasing Childcare.
Well, now we're going to talk about the fact that childcare and affordable childcare, it's been an issue for many, many years. I think across the nation, it's fair to say. But how has the need for childcare changed since the pandemic, and how have the challenges changed?
Right. I can start by saying that I think that the pandemic raised awareness of the real need for consistent and stable child care arrangements, not only for working families, but for economic recovery and just for the general workforce in general. And I know, Sheila, you had mentioned something during the break about the generations and retirements. Do you want to talk more about that?
Well, I know that being a part of some of the groups on different social media, over when the pandemic started, they talked about how maybe it's just not the best fit for them anymore, or it's time to retire after 30 years. I know I had a friend who told me that there was at least during the pandemic over 20 daycares that decided to close their doors, and that's hard. That creates so much stress on so many different parents. I know that even centers close their doors. Perfect Start closed, ECLC down south is now closed. So it just puts more stress on everybody else.
Yeah. And it increases that need tenfold. And Tessa, you said it's kind of another situation in the more rural areas.
Yes, so when I first started child care till now, the class sizes went from about 50 and now they're up to 300. And so there's all those little kiddos that need daycare, and we don't have any availability for them. So it's grown a lot on the west side.
Now, they're in the rural areas especially, we're talking about child care deserts here. I know that that's been a phrase, a word that's been used a lot here. So it's happening in a number of rural communities across the state, and again, I think across the nation as well, such as Watford City, and what you are experiencing there. So how do these challenges compare to more populated areas? What are the different challenges?
I can maybe start with just the definition of child care desert. So that's an area where there may be 50 children or more at ages 0 to 5, and they have either no providers or they have 3 children for every licensed slot that's available. And so across North Dakota, we have 17 counties that could be identified as child care deserts. And across America, probably 50% of Americans are in child care deserts.
And speaking of that percentage, what about here in North Dakota?
As far as the number of families?
The percentage of North Dakotans living in these child care deserts.
So, you know, it would be 17 counties. I don't have the actual number of citizens.
But 17 counties, that's a significant number of counties in the state of North Dakota to be experiencing that.
And Kay, a follow-up for you. According to the survey of income and program participation, on average, families in rural areas spend 12% of their income on child care. Do you see that here in North Dakota? Is it more or is it less?
I think in North Dakota, families spend a much larger percentage of their household income on child care.
Yeah, and I think that kind of is the situation in a lot of areas here in North Dakota. The cost of a lot of things here.
Absolutely.
And are there cities in North Dakota that are cities in North Dakota, I should say, very different than our rural communities when it comes to the cost? You know, when you have the smaller communities versus the larger communities and the cost of child care.
That's a great question. When I think about that. Cost of care, the workforce, the employees portion is the largest part of a child care operation in their budget. So the administration and materials, and then their rent or their utilities, mortgage, those types of things are that other portion.
I think where we are too, we don't have access to the larger stores. So we have, you know, the trucks coming in that have to bring us the stuff, or Going uptown to get something is a lot different than Bismarck, where we don't have not a lot of options. We just have 1 or 2 options to get things from. So we are getting charged higher for things because of our area.
Mm-hmm. And now, Tessa, starting with you, how difficult is it to get a license here in the state?
Gosh, it's not awful. The longest thing would be the background checks. And so that they have gotten a little bit faster on that. So that's going to be, I would say, one of the biggest things that it takes to get the license is just getting everyone their background checks and the space and the ratios to follow, things like that. Everyone gets renewed, every year. And so I just went through one of my centers and I'm going through the other one. So it's not crazy, but I would say the biggest thing is the background checks that take the most time.
Now, Sheila, what was your experience like?
A lot of it was, it's just getting through the paperwork and getting through all of that, because we took a whole building and gutted it and then started from scratch, trying to figure out the room sizes and things like that. I did have the licensors involved, actually all 3 of them came over and watched the progress of it, which was kind of neat, but in the long run, it took forever, and then you're like, okay, am I going to be licensed by this date? Is it going to be this date? Like, what's going on? Like, where's it at? And then it's just making sure that you follow up with them and like find out, like, are you missing anything? Here's your, here's the memorandums, here's this. And starting from scratch, it was, you have to have so many employees, you have to have so many of this, your CDAs, your, right down to your first aid and CPR. So it's, and making sure that they have all of that, because if you're missing something, it's going to, prolong the process.
Okay, is there an average length of time for someone to acquire a license, or does it really vary?
I think it really varies. Each individual might take their time discerning, even just operating a childcare business, and so that time and that discernment process can, for a large program, can take 18 months to 3 years sometimes.
There's resources out there to help you along the way, just like we were saying earlier. It's great. Thank you. And thank you so much. Stay with us here. We will have more coming up on Chasing Childcare.
With Life Alert, one touch of a button can get you help fast.
And the cultural hub of the Mandan, Hidatsa, and Arikara Nation. Nestled along the shores of Lake Sagagawea in Newtown, North Dakota, 1 mile west of the Four Bears Casino. You can enjoy amphitheater performances, art exhibitions, and educational workshops utilizing our Living Cultural Center. Enjoy some coffee, browse our gift shop, and learn about the original people of this land. Learn more at mhanation.com/interpretive center.
And welcome back for our latest town hall.
Now, Kate, can you talk to us a little bit about what types of state and federal incentives, funding, grants have been beneficial in tackling this child care problem?
Sure. So with the support of the governor and our state lawmakers, the North Dakota Department of Human Services has been able to make available a number of grants with federal relief funding. And so actually in March of 2020, we made the Child Care Emergency Operating Grants available to child care programs. And that really helped during that time where they had fluctuating enrollment and even staffing to be able to continue to sustain their operations and to follow some modified operating procedures when we started out with COVID, because we really didn't know what we didn't know what we didn't know about keeping kids healthy and safe during that time. And so that was the first thing. And then there was a gap. And in the fall of 21, we used some American Rescue Plan dollars to provide stabilization grants. And so maybe our other panelists would like to talk about how their programs have used those grants.
Tessa, would you like to start with you on
We
how
love
you
that grant.
utilize? Yes.
We want it more. We have a gap that my board decided we don't want to raise our rates. We want to keep them affordable to all families. And so instead of raising the rates, the city was coming in and giving us that gap income. And so we didn't have to raise the rates. Well, when that grant came through, we could just use that grant, and so that helped. But unfortunately, we are maxed out. And so if that was something that was, you know, would keep occurring every month, that just took the edge off, closed the gap. And so right now we're still okay. We haven't had to go back to the city, but that just took the edge off everything.
Visiting with you, you had mentioned caps. And you kind of wish there wasn't a cap at some point. Can you explain that to us a little bit?
So the grant maxed out. So it took into account if you took care of infants, if you were in a county that was high needs, which McKenzie County is high needs, you just had to plug a few things in, your employees, things like that. And then based on your license, your capacity, all the, like I said, like the different questions that they ask you, they would send you this amount. Well, it caps out at $225,000, and so now I'm capped out. And so if that could keep going, because we still have the cost, and we still don't want to raise it for our parents, but we need a little bit to close the gap.
Sure. And Sheila, you've been applying for a lot of grants now that you're open and you're running, and taking in kids with special needs. You know, you're trying to be all-inclusive in the different grants. What kind of grants have you applied for, and what's been helping you?
We did apply for the Child Care Startup Grant, and that helped us a little bit with a lot of the funding for like playground equipment and getting things going. I applied for the Inclusion Grant, but unfortunately there were no funds left. I was approved, and so trying to include kids with all kinds of special needs in our center is, you know, trying to get them to school, trying to get them the things that they need, weighted vest. We can only do so much, and parents, you know, they apply for those programs as much as they possibly can also, but when there's no funds, there's no funds. I mean, the stabilization grant is great, but there's also other things that could help.
So I have some news for you, Sheila. So in July, the state has some dollars for inclusion grants, and so we use the federal dollars first, and those we had $1 million for inclusive child care support. So programs could use it for their staffing, for environmental modifications and materials and equipment, and now we have a small pot of state funds that's available. And so if you want to connect with Aspire, they are our inclusion support coaches, and they can help you get connected to one of our grants.
That would be awesome.
Yes.
Some great news.
That would be
Fantastic.
Yeah. And looking ahead, Kay, what are some of the state's other short-term and long-term plans when it comes to child care?
Well, I think we've got some goals. You know, we would like for there to be the compensation and the support for our child care workforce and their training needs, and then for parents to be able to find child care when and where they need it, and not to pay more than 7% of their household income on child care.
And in other realms here, talking about community support, Tessa, you were talking about how great the community is in supporting you, and so would all of you say the same thing, that that community support is vital to keeping the child cares open and running? Because you were visiting other child cares in other cities, and they were not getting the same support that you get in Watford City. How much of an impact does that have?
It's huge. We wouldn't be where we're at today if it wasn't for the city and the county and everyone just banding together to realize how important child care is.
And is this in the way of investments? Like how does this work with the community helping child care centers?
So with us, Wolf Pup 1, which is where we're currently at, the county came in and paid off our mortgage, and the city was subsidizing that gap that I was talking about. We also rent for our learning center a building from the city for that. And then also with Wolf Pup 2, coming up here, August 2024, the county is paying for the building on that.
Wow.
Now, if someone is listening at home and they feel like they might want to open up a child care center, can you talk a little bit about the steps and what resources the state can provide to assist?
Certainly. So they could reach out to Child Care Aware of North Dakota. There's a website, ndchildcare.org, and there is information for starting different types of child care. So in-home, which would be family or group child care, and then facility-based child care like the centers that these panelists are running. And so they have staff that can come out, they're startup coaches, and can help communities really even thinking about it. So the way it's successful in communities, it's not just one person trying to solve it. There's a team of people that gather together. Sometimes it's the city auditor and the banker and the person that runs the hospital, and so there's a team that's getting together to think about that, and it's right size and right fit for that community. So a lot of times we think child care center just because that's what people think of, but sometimes a home child care that might have 7 to 9 children might be the right fit and right size for that community.
And maybe just starting small. Like Sheila, you started much smaller, and you grew to now a 200-plus child care center. And same with you, Tessa. You started small and grew large. See if that's really what you want to do, and the resources sound plentiful. Definitely.
And certainly the need, as we talked about today in the state.
Absolutely. Well, thank you very much, ladies. Thank you very much, Kay and Tessa and Sheila, for joining us today and speaking on this topic. It's so important and it's so vital, and so it's good to see that we're have all these resources and getting the help, and we'll keep making our way here. We learned a lot about our state and the issue of child care in our cities and our rural areas, and we want to thank you at home for joining us here for this KX News Town Hall. We hope that you learned a lot about childcare and the struggles that families are dealing with on a daily basis.
We thank you again for watching, and we'll see you later tonight for KX News at 9 and 10.